But when we then look at technology and current developments, it also means it's not a fast industry. So you have great ideas, you want to test them out, you want to drive the improvement for your customers. Things are a little more difficult. There's a huge need in the admin side of things, so really giving doctors more time so they can care for the patient where a human is needed, and some stuff where maybe the human is not needed can run in the background. The CX team they have, the goal is to have no customer look for help. So everything has to work so perfectly that the moment you type into the search bar contact or help with an order, their KPI is not green anymore because something went wrong in your experience that you even needed. And you call someone or I call someone, I can tell if they're empowered. They make a decision for me that helps me. Or if they're just sticking to a script and just, I can't help you. So when we look at the technology piece, I always feel like healthcare is a space where you have little room for error. And it's not a space where you...
Hi, my name is Jochem van der Veer. I'm the CEO and co-founder of a company called TheyDo, the journey management platform for business decision-making. We raised over $50 million and are growing globally. Our enterprise customers include Ford, J&J, the Home Depot, and Pfizer. I mean, wherever you look, understanding customers is key to staying ahead. But in order to do this at scale, aligning so many different teams with the customer journey is incredibly hard, but it is possible. I really wish this podcast existed before we started our company because so many companies are organizing around journeys and there's so much to learn. So in order to share what I'm learning, what I'm hearing with our community, I meet with industry experts. And in my video podcast, I'm here to explore the world of business strategy, design, and journeys, customer journeys, to really get an understanding of how leaders are changing their way in their business. So let's dive into the show. My guest today is Tina Lilje. She is the former global head of customer experience at Philips. Okay, she designed, launched, and executed a Philips-wide B2B customer experience strategy and program for over 100 countries, 75,000 employees, 22 business units, and all functions supporting by the board of management. But what's most fascinating, and I'm sure we'll talk about it today, is that she started out in marketing, went to customer experience, then took an M&A role before going into customer experience leadership, a career at Philips that spans over 2 decades. So we had the internet, then we had mobile, now we have AI, a couple of tariffs that are flying left and right that heavily influence the way business gets done. Tina has lived through it all. So very much welcome, and I'm very glad we can have this conversation today, Tina.
Thank you, Jochem. I feel 80 years old now. But yes, thank you. And yes, I've certainly seen a lot of changes in technology and otherwise in that time. And like you said, going back and forth through many functions has really sharpened the way I look at whatever it is that leads to customer experiences.
So maybe we should start with like taking the bull by the horns and talk about AI, because you are in healthcare. And if there's one industry in particular that AI is a very peculiar topic, it is, I think, in healthcare, because when we were pre-chatting before going on recording, you actually said something along the lines of like humans are actually a premium right now. So I think we should start there. What do you mean?
Good.
You have seen it all. I mean, why are humans at a premium?
Don't make me sound so old. Thank you.
No, I'm not trying to make you sound old, and I apologize for that. But what you have seen is like pattern recognition, right? Especially people coming into customer experience roles today or thinking about how the customer experience is changing. It's like AI. But if we zoom out, it's still about humans. So tell me, what's your point of view?
Thank you. And I was just joking, you know that. I think there's different things that you just mentioned. So one of the things is healthcare is an industry which I do believe is different than other industries in many aspects. And for me, it's easy to draw the comparison because Philips has consumer business and it does have the B2B and healthcare business, and the approach to how you handle customer experience in those different areas is very different indeed. So when we look at the technology piece, I always feel like healthcare is a space where you have little room for error, and it's not a space where you try out a lot just to see how it goes. So let's say you want to try out a new kind of self-help technology, however that's powered in the background. And when customers call, you guide them through things first and try to get them to see if they can fix things themselves. Now, if you are calling to try and find out how you place your battery in your shaver, or your toothbrush holder isn't charging or something like that. I think that's fine to have some trials around that. If you have a patient on the table and the system is malfunctioning during surgery, that's not the moment, right? You need to immediately have a person, a human on the line, and they need to send someone now, or like 10 minutes ago. There needs to be someone that fixes the issue, because it impacts the health and well-being of people, and it can or cannot impact even if people live or not. And so it's also a super regulated industry because of what I just said, and it's rightly very regulated. But when we then look at technology and current developments, it also means it's not a fast industry. So you have great ideas, you want to test them out, you want to drive the improvement for your customers. Healthcare is not a place where that will go very, very quickly, because regulations, approvals, and that's in every country. And so there is a huge demand for it, and I think there's a huge need for it. On the clinical side, think about analyzing X-ray images, trying to find out where there are unusual things that you can see, try to detect anomalies. And that is very far advanced already. It's used, it's fantastic. Absolutely, no question. Other things are a little more difficult. There's a huge need in the admin side of things, so really giving doctors more time so they can care for the patient where a human is needed, and some stuff where maybe the human is not needed can run in the background. That's also easier to get approved, and you can do it immediately. But yeah, it's an industry where you have to have 100%. It has to be 100% correct. I just saw, I mentioned that earlier to you. I just saw a presentation from the head of the emergency room in a German town called Lübeck. And he talked about AI in healthcare. And he said in 1975, it was about getting all the information that you can get into yourself and learn everything. And then in 2000, it was be efficient in filtering out what you need and what you not need. And in 2025, it's filtering out the lies that you're getting from the AI, because you still need to check it, and it still needs to be 150% correct if you talk about humans and patients. So it's interesting, it's exciting, it can make lives a lot better, a lot. Super fast advances, great stuff happening. But I do think we also need to understand when people are critical about it, what I say to them, it's not always a decision on whether you have technology or a robot, say, like in Japan, or a person. The way things are going right now, when I'm old and need care, maybe it will be technology, a robot, or no one, because we also have trouble finding enough people for certain professions. And so technology can really help with that. And we need to be open to it and explore what we can get from it. But yes, humans are at a premium, and we all want a human to care for us and not a robot if we have a choice. And we want to have that understanding and empathy, I think, where we can get it.
What surprised you the most about how clinicians actually want AI to support them versus what tech teams assume?
Tech teams, many, I think, assume that people want the latest and the greatest, and what they want is the greatest and the most reliable and the most tested. Doctors tend to be very open to it because it helps them with their workload, and it helps them be better doctors for their patients. But they want tech also in a lot of areas where it's not necessarily clinical. And I think we underestimated that in the beginning. There's scheduling patients not showing up for appointments. It's a huge money drain on many, many private practices. And if you have an AI that can predict certain behaviors, if you have an AI that can help you reschedule in time, predict things, change appointments, predict when people will leave the bed in the hospital so you can move in someone else because of the data that you fed into it before and the learning mechanism that's behind it. And it helps you be more efficient and care for patients better, then they're all over it. But it's not all clinical. There's so many aspects to it. And I think many people in healthcare start with the clinical because that's kind of cool and because that's what we think of when we think healthcare. But there's this whole back office thing that you need to run efficiently to be successful.
Right. I think this is cool because one example I know of, this was a super simple solution back in the days, before AI even. They were optimizing the parking space availability through SMS, and they were helping patients to find the right parking space in the hospital so they wouldn't miss appointments, because the no-show rate for like a big portion was actually driven by people who couldn't find a parking spot.
I was there, but I couldn't
appointment.
come in. I'm sorry.
Exactly.
Yes. Yeah.
So just by routing the SMS saying like, hey, P5 is available instead of P4, go there, and then you walk 2 minutes
take the
longer,
next
but you'll be
one.
available.
That's awesome. I hadn't heard about this, but yeah, sometimes it's the small stuff, right? I don't know if you have in the Netherlands an app called Doctolib. I think it's from Sweden. We use it in Germany a lot, and it helps you schedule. And you can say, okay, please put me on the wait list and inform me if somebody else cancels. And I get almost always I get early appointments. But for the doctor, it's awesome because they don't even have to pick up the phone. They don't have to care about it, and it just backfills automatically. So patients happy because I see the doctor earlier. Doctors happy because no downtime and no extra work getting that done. So some things like that that don't sound huge can have huge impact and take out stress out of the whole, for you just described the stress out of the experience for the patient, stress out of the experience for the doctor because they don't have to worry about too much downtime of their expensive equipment. It's just sometimes it's the small things, and then sometimes you have the huge differentiator. But I think more and more we just see tweaks that make life better in the background somehow.
And yet we still focus on like the clinicians and that experience there, but like we forget about like the whole patient journey towards like the appointment, towards like having the interaction, and then from the clinician side as well. It's like, why do you think teams find this so hard to do? Like, it sounds like that's not something that you and your teams did incorrectly at Philips, but what is the problem? Why is it so hard for us to really understand like that end-to-end experience, that journey, if you will, and then understand like how we can actually solve every part of it and not just the actual interaction where our machine, in case of Philips, is actually like useful to the clinician?
I think that's just how humans are programmed in a way. I think that's like superhuman behavior. I do think so. For me, you said we didn't do this. I have the benefit, of course, of talking to customers a lot and seeing all the data. If you don't have that benefit, I think it's easy to assume. And it's also much cooler. Like people are getting excited about the changes they can make to the healthcare industry. They get excited about new technologies, but you know this from your work as well. You always have to start with a customer problem you're trying to fix. So don't go in and say, hey, I have technology. Where can I find a reason to use it? You have to say, this is a customer problem. They don't show up because they can't find parking space. And then how do I fix that? Which is, yeah, it is less cooler than, helping cure cancer patients, but it's still needed day to day. So I think that's one thing. And the other thing is that, quite frankly, a lot of people focus on their part of the puzzle, which can be because that's what they know and where they are excelling with their experience. It can be because it's hard to kind of think 3 steps ahead if you don't really know. It's kind of murky what's happening there and what happened before. It's where you get your incentives for, where you get your annual, like where people tell you this is what you need to do. Like we're conditioned at work to look at our part of the whole. And that's why I think that journey maps are so super impactful. Eye-opening, because once you understand I do A, and then 3 steps down the line, that means this happens. And something happens in between, but it's on me to make sure that is available and that's possible. Once people understand, it's awesome. So we put, when I was in the Amsterdam office, we put a huge image, a high-level radiology journey on the wall, just because the wall, quite frankly, was really white and boring and not very nice. And it was just kind of to liven up the place a little bit and maybe get people thinking about customer. And then we noticed a week later, it started to get more and more happen that people would actually come up to the 13th floor and take pictures. And they would stand in front of it and talk about it and point, and they would go back with their pictures and tell people on the lower floors or higher floors about what they'd seen, and you should go there and look at that. It makes a huge difference when people start to understand. And then I think, going back to your question, you start to think more about the customers because you see the impact it has. And then maybe you say, okay, this is like the end goal. We'll cure cancer, but what can we do in between? What's the low-hanging fruit? What's the small stuff that keeps the doctors from focusing on what matters? And can I do something about that maybe too? And maybe you can.
What do you think was the wedge into this? I mean, you came into Philips from marketing. You went into many different departments.
I was a secretary when I started. It's not in my CV.
Nice. Okay, so we learned that as well. You were even a secretary when you started, and you worked your way all the way up to leading the global experience strategy. So what was the wedge for you? Like, when did things start to really click? What allowed you to unite the company around the customer experience? Like, I don't know if there's a point in time.
There is a
Maybe it
point.
was this journey.
No, there's a point. I'm just trying to remember what day it was, what year it was. It was when I was leading customer service for DXR and mammography. So global customer service role, big step for me, super exciting. And it was a wonderful job for me. But I noticed after a while that I kept fixing the same problems again and again and again. And after a while, you think, hey, it would be nice if, it's stuck and I could fix something else. In this case, it was a detector, a service part that got MIDI design prices, but it didn't have a proper handle. So in the emergency room, when it was slippery, there's fluids everywhere, it would slip and fall to the ground. And you never knew if it was still usable or not because there was no indicator. So customers would call me for replacements and I had to approve all the replacements because it was so expensive. So most customers were in the US, I was in Germany, phone was ringing at night just to approve this part. And it kept happening. And it was super frustrating because we were unhappy, the customer was unhappy, there was fights about who's paying for what, is it part of the warranty, da 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 da. But the problem was, it was a design problem. It happened many years before it came on the market. They didn't put the handle. You can't change that backwards easily. It all needs, we talked earlier about regulated industry. Everything needs to be approved again for every single market. It's huge. And also, I didn't have the influence to work with a supplier that way in my role at the time. And more, I got to a point where I said, I'd really like to be in a position where I can fix root causes and where we can just fix one thing and move on to the next one, because there's enough to do always in every company, I guess. And so I did the service role. I went into M&A because I wanted to see something different, wanted to learn. You learn a lot when you look at different companies and how they do things. And we bought amazing, tiny companies with great technologies. And then my boss at the time volunteered to be the exco sponsor for customer experience. And then she called me and said, hey, somebody needs to lead it. And we thought, we're going to be done in 2 years. It's easy peasy. We'll do these like 4 things and be done. And that's not how it works. And so it became a full-time role. And that was the role where I could start fixing root causes. You go to the beginning of the journey before the customer is even there, and you look at the design process and you try to figure out a way, not for that part, but to tweak the process in a way that these type of things don't happen, that the actual use is included in the design, is considered right from the beginning. And so you don't have to go back and change it because you do it right from the beginning, which is also much cheaper. And I found that very rewarding, quite frankly, just to know that is a change that sticks. I mean, we talk about change a lot. Customer experience is a big change for many companies. And then how do you make sure it sticks and it doesn't go away the moment you move on to the next role or to the next whatever? How do you make sure it stays? And it stays when you fix root causes and not the symptoms. And so that's the moment, the detector. I have one here. My team gave it to me when I changed roles. It's lovely.
Oh, wow. But I love this example. And this is like such a good one and such a lively one. For many CX organizations, this is not reality, right? They're keeping the score, they're making the reports, they're asked to measure, analyze at best, and they are aware of the root causes sometimes, but their hands are tied. They are not tied to the business, and then they do the wrong thing because they go and present and share their insights and findings, and all wonderful, but no one wants to listen. What
I
did
had
you
that
do?
too. Like, please don't think it was easy or always happening. Absolutely. I mean, this is always there for CX, right? Because the nature of the beast is that when you do it right, my view, you do it end to end, not just like digital or not just this piece, but you do it the whole thing. But you don't own it. So my boss and I had great discussions about, okay, we'll do CX now. Is it going to be a program? No, we had already noticed it's not going to be finished. So no, it's not going to be program. It needs to be a function. Okay, then what does this function own? Quite frankly, Joachim, nothing. Because if you own everything that has to do with customer experience, you're the CEO. That's it, right? Everything has to do with customer experience in a way. And so it's a difficult situation where you don't own it. You're not the one accountable for it necessarily, at least maybe for NPS, but you're not accountable for the pre-sales process or the invoicing or the manufacturing part. But you still want to go in and tell people that they need to change the way they work. That's a tough one. And it really also depends on the people, their managers, the goal setting, all kinds of things. So I think what you just described is more normal than the other side of things where you can actually do deep-rooted changes.
When you were able to make those deep rooted changes, like what was the nature of like the engagements with the different teams, or like how did you do that? Like what, for instance, like what I'm seeing is that the customer experience functions that are doing this correctly, they're bringing the finance people, they're bringing the risk management people, they're bringing the operational people together and say, hey, do we all agree that this problem is worth solving? Like, can we solve it? What will be the benefits of solving it? They build it out together. It's almost like a solved problem, including a solution direction. And then they go up in the organization and say, okay, this is a key priority. Here's how we're going to address it. But the ones that are not able to do it, they only have the problem. They say like, here's the problem. Here's what it is caused. Like, so can you share an example where you were actually able to do it in the correct way, where you actually helped to do that? And maybe like what were some of the principles that you later on put in your teams to make sure that they could do it continuously and not just as a one-off? Like what would be a good example of how others could apply this as well?
This is a difficult one because there is so many things that contribute to that. So yes, you need to have a sound understanding of who is your company. Like, what is it? What is the goal setting? What's the list of priorities for your executive committee? Or you start with your boss or whatnot, depending on where you are. You need to speak their language and you need to understand what they need to achieve. And then you need to frame it, I think, mostly in a way that supports their goals. I found this very hard in the beginning because for me, customer experience makes just so much sense. It's so logic. How am I expecting to be successful and make money and sell my product, services, whatever, if the customers don't like what I do? They're not going to buy it. Unless you are super monopolist and very lucky that way, it's not going to work. So for me, that was always very simple, but you need to meet people where they are. So the first training I did, I actually had to explain what a customer is, and I did not have that in my slides because I thought everybody knew. No, you start with zero, and you do that everywhere. You need people on the ground support because they're the ones that have to execute it. I talk to customers, but I'm not the one delivering the service or selling something. They need to be on board. But at the same time, you also need the leadership on board because they are the ones that set direction. They have to lead by example. They have to align on KPIs. And it takes a lot of talking and convincing. And the best that you can do is find your one or two partners in crime, a mentor, someone that understands what you're trying to do and can guide you in how do I sell it and what do I ask for. You will always need some funding. It's not for free. But I also see a lot of people that go in and want the big strategic change directly. Let's not waste time. Let's go for the big bang. I admire you. It's probably not going to work because nobody's going to give you, I don't know, 2-3 million if you don't have a proof of concept. So you need to find a mentor that helps you guide, because when you start, very few people are so high in the organization when they start that they already know all this. And then you need to find your proof of concept. You need to find proof that the investment is worth it and that what you're suggesting works. And it doesn't work for NPS. NPS is great, don't get me wrong, but it has to work for the priorities of your CEO or CFO or COO or whoever is the one that will be the one that helps you. Their priorities need to be met. And then one other thing that I think is easier to do than that one, because that's not, is I always had the customer speak. Because if Tina goes in and says, hey, customers unhappy with the, I don't know, pre-sales process or FCO process, or I don't know, the way it works when they call, I don't know, it can be anything. If I go in and talk about that, people will get defensive and they will explain to me why everything that's in place is the way it should be, because I'm indirectly, without the intention to do it, I'm criticizing their work. But when a customer speaks, they can be on video, they can be in the room, that you can even record it advanced, doesn't matter. Just the customer, you can't argue with them. I cannot go to the head of surgery in a London hospital and tell him, you know what you're saying is wrong. You really like it. You just don't, I don't believe you that you don't like it, and that'll make a difference. And that takes out a lot of the heat, because in the end, we all want to do the same thing. We want to have happy customers. We want to enjoy going to work. And for me, that goes together. We want to sell whatever we're offering. We want to service what we're offering, and we want to keep customers longer for just one life cycle. That's what we all want, no matter where we are. And that's the reason why we exist. If we didn't do that, why do you need the company? But you need to come to the point where nobody feels criticized and everybody feels like we're in this together. And for me, it was having the customers speak up instead of me. But it depends on the company, I guess.
Well, what did you have to learn first? And I'm curious, like, how you picked your mentors, because it sounds like when you came in, you were all about the customer and you didn't really appreciate like how the business works. You almost ignored it, like many people do who start like with almost like a vision for what customer experience can become, until you realize we're in the belly of a big beast and there are certain ways that we have to work through. So how did you pick your mentors? I assume they weren't necessarily customer experience professionals. I assume they were.
No, there was no one. No. Good question, because you spoke earlier about how I came into the company, and I was looking for mentors from basically pretty much the beginning, because I was always interested in how things work, and I'm someone who gets bored fairly easily. So after 2 years, I wanted to go elsewhere, and I understood that you need someone to help you. They're not just waiting for Tina, the assistant in the Sales Excellence Center. There's so many people. How do you stand out? You need someone to speak up for you and guide you. So that was what was happening. And quite frankly, so I did the service role, which I loved. And then I felt it was time for something new after 3 years. And there was a big meeting in Hamburg where I was based, and everybody was coming, the whole executive committee. And so I got very brave. I sent a message to the new COO, who was a woman, Sophie. And I said, Sophie, I'd really like to work for you. I know you're in Hamburg. Here's my CV. Do you have time to talk? And I didn't expect an answer. And then 2 days later, her assistant's like, yeah, 15 minutes, be there at 2 p.m., canteen building or whatnot. And so we talked, and she said, I like the approach, and let me just think. I think I need someone to do M&A. And so I ended up in M&A. Okay, let's do that. I wanted to learn, and I wanted to work with her because I really was impressed with her. And that's where I started. And then she was the one that volunteered to be the executive sponsor. And then she said, but somebody needs to do it. You worked in marketing, right? And I said, yeah. Said, new job. You do it on top of. So it was just like, you help out, you do it when you have time. That was the start.
Of customer experience, you mean?
For me. So there was amazing, impressive customer experience work happening before in Philips. In my view, there was one problem, and the problem was it was in global customer service. And again, this depends on the company, right? There's companies where that works really well. I had the feeling that a lot of people just sat back. Oh, wow, good. Service is taking care of customers. Wonderful. I don't need to do anything. And that's not how it works. Customer experience is everybody's business. And so I said, I'll do it, but I will not report into service, because we've tried that twice. The people were amazing, but they didn't get the traction outside of that huge function that they needed to really impact the whole company. So let's try a different approach. Let's not do it a third time. And so I ended up in operations, which I can argue any function where it should sit. For me, there is no one size fits all. And yeah, so in the way, she almost picked me. But it was because I spoke up and I just said, hey, I like you. Can I work for you? I'm looking for a job. This is my CV. I think I can bring value to the table. Do you have time for 10 minutes? And then you be prepared and you're open, right? I was doing things I had no idea about when I finally moved to her organization. But I do find that a lot of people like being mentors. Many companies also require from executive that they mentor people, a certain amount of people, which is not necessarily well known. If I had I was always looking for someone that I felt I could connect with, and that was in an area I liked. And then I try to see, did we have a connection in the company? And I try to get someone they knew better than me to ask if they would be willing. And if that wasn't happening, I was asking them directly. But it was always me trying to figure out who'd be good, Where would I like to know more? What do you need to be very specific? What do you want to be mentored for? Don't have them figure it out. You need to know, make it easy. And most people said yes. So I think it's be brave, go out and leave the door open, right? I always said, hey, I'd like this. And if you don't have the time, I understand. I just thought I'd ask. And I didn't get one. I didn't get a no once, not even as an assistant. But you have to be brave.
If you're enjoying this conversation, don't forget to subscribe on your favorite podcast channel and leave a review. It makes all the difference. The Experience Edge podcast is where I interview business leaders, CX pioneers, and the best designers who share their insight on creating business impact, having an edge on the customer experience. Do you want more exclusive content and behind-the-scenes access? Check out the Experience Edge podcast on YouTube and LinkedIn so you don't miss a thing. Now let's get back to the conversation. I think this is such an undervalued lesson. Just ask. I mean, this is the tried and true example, right? If you ask for advice, you get money. If you ask for money, you get advice. So sometimes you have to ask for one or the other to expect nothing and to get something in return. Even
and
a
honestly,
job.
Who wouldn't be flattered when someone comes to you and says, you know so much, can I learn from you? I mean, that's basically what it is. But you have to put in the work and you have to do it and you have to be very clear about what you want to achieve. Otherwise, you're just delegating the work to them. That's not fair. But yeah, I like coaching people. I still do it. I still coach people in Philips too.
But it still sounds like in operations, it was actually a blessing to start Experience from there because you're not necessarily tied to a supporting function that has their own KPIs, but you could look more holistically at the beginning to create those small wins that you talked about. So what were some of those small wins leading up to? Like, what was the first big win? Like, what was that in your mind? Like, how long did that take you? Like, how can you actually like paint that picture from like early small wins, like getting permission to do more, and then ultimately getting the first big win?
Good question. So I want to be clear that I was super, super lucky to have someone sponsoring this program on that high level. Was reporting to the CEO. I did not report to her directly at the time. There was layers in between, but I was lucky to have a sponsor at that level. And I had a sponsor who really, really was very customer centric from other companies as well. And the first thing I tried to get her to help me with was to get the visibility to the executive committee. So I wanted people, it's a big ask actually. I wanted like 2 hours once a quarter with the whole executive committee, or at least a selected people from business leaders, market leaders, CFO, to bounce ideas off them, to understand their priorities and to find common ground to move forward. That is a huge ask and it took a while, but it worked. And then the first thing we did is we went out and interviewed customers ourselves, but also via an agency, and had them just in the middle of the life cycle, but also when deals didn't go well, talk to them about how was it for you. And the benefit was I wasn't in a sales organization. I didn't know the products well enough to try to sell anything to them. And I also didn't have a sales KPI. So I was Switzerland. And they really liked that. And they were super open. Like they have no time to waste, right, doctors? And they told me exactly. It wasn't always pretty. But what we figured out very quickly is what customers wanted wasn't a product, they wanted a partnership. And a lot of that is mindset. And actually, the contract doesn't look much different. It's a mindset, it's a way of approaching, it's a way of communicating in a way. And we notice that things go wrong all the time. There's no other way. And people understand that. But when customers felt we were partners, it mattered less. So I got interviews that said the service part was too late. The patients needed to be rescheduled 3 times. What a mess. And then I had someone else who said the service part was delayed, but stuff happens. Hey, your CEO was visiting us the other day. He's a really cool guy. Same thing. Super different feeling the customer has of that experience afterwards. And so once we figured that out, we started doing a sponsorship program where we had all the senior leaders sponsor 2 or 3 core key customers. We try to not do it in their own region or business because they should do that anyway. And be with the account manager once a year or whatnot, talk about strategy, talk about priority setting, where's Philips going, And they wanted to hear from other users what they can learn. And so these type of things developed from that. And I think that was the first big one because it had so many effects. It brought our most senior leaders closer to customers. It turned transactional customers into partners. It made other stuff we still needed to get to fixing. I mean, service parts were still late, but it mattered less and they were happier. And what you also want, you know what brand is. It's what people say about you when you're not in the room. They talk. They go to congresses and talk. I wanted them to talk well about us. I wanted them to say Philips is good. And I want them to say, if I have to replace my equipment, I'm not even looking at anyone else. No, we didn't get there completely. It's always work in progress. But that's the holy grail, right? That's where you want to go. And that was the starting point. And then after that was a lot of the classic stuff, right? Journey mapping, pain points. Pain points were usually different than we expected. If you
The
ask
classic.
anybody, huh?
That's the classic, right?
Yeah, it's
Once
not
you
always
really
price
start
and
to figure
features.
it
A lot
out.
of the time it's address label can't be read and I can't find the delivery, stuff like that. And then we started with trying to get as many employees, colleagues as possible access to customers. So everybody wants to go to customers. You come to a healthcare company to improve lives, and then you want to visit customers. But customers do not have time for 70,000 people to run through their halls. It's not working. It's impossible. So we started and did CX days. And we had customers come in, we called it fireside chat. So like you and I are doing, maybe the account manager in the room with them. And we had half an hour, me or the account manager talking. And then we had 20, 30 minutes people on the Teams call asking customers questions. And people never had that opportunity before. So that was a huge success. And the moment people understand their impact, it takes on life of its own. Once you understand what your impact is on the customer, especially in a setting where you come in to make an impact, that happened. And I have to say, though, to be fair, I think Philips Healthcare in that way is easy, or the healthcare industry, because people have that purpose in mind when they come to your doors, right? And then you hear about making lives better. And then you apply, you get the job, awesome. And then you sit in your office in trade compliance and you can't see where you're making lives better. You're just filling in paperwork. And then it's about framing it. No, it's not about having the correct paperwork. It's about you're responsible that the system delivers when we said it would, and no patient needs to be rescheduled because everything goes smoothly because your paperwork is ready. But you don't give a KPI on the paperwork. You give you reframe it. And then it works. I do think you need to understand who you are as a company and should you be outstanding or not, and what can that look like? And then it needs to fit. You know, you and I talked sometimes about authenticity. Healthcare is easy in that way because you see the purpose more easily. I think if you print postcards, maybe the purpose is a little harder and maybe your experience then looks totally different.
It's all way more transactional maybe in that case. Oh, what I'm curious when I'm hearing this, like step by step, it sounds like you're turning your organization around from being like completely inside out, focused on their own like KPIs and what have yous, to being customer oriented. While it wasn't, everyone wants to do it, but from there things start to make sense and you need to build processes around it. So maybe like to start there, like what came first? You mentioned like, I want to have 2 hours a quarter from the executive team. Or did you start with like, no, let me just prove that we don't know enough about our customers. Let me interact with them. Let me build these connections. Let me have the teams actually interact with them. Like what came first before this like shift happened? And then on a leadership level, people started to invest in the customer-centric strategy that you're starting to roll out. Like what came first? Like, did you say like 2 hour meeting every quarter starting the next month? Like where did you see that? Like what came first?
So Sophie put me through the paces, right? Just saying I want 2 hours a quarter is not going to fly. It's like we spent weeks, months discussing what would be on the agenda. What do you do to make it worth the time of so many very high paid, very important people? Because that's what it is. It's 2 hours of the most highest paid employees in the company, and that's a lot of money. How do you make it worth it? And maybe can it be 90 minutes? And maybe can it be... So you need to sell the meeting first. I did not go in a negative way and say, we don't know our customers. I think it's a mistake many CX leaders do, and it's very easy to make this mistake because you see so many things that go wrong, and so you want to fix them, and you have to be very, very careful to keep a balance and not become too negative, because there are amazing number of customers that are very happy. It's just they don't call you. That's not the ones that show up in my inbox that I have to deal with. The ones that are happy are just quiet usually. So you need to be careful with that. I think everybody needs to. And so it was more about, hey, we've decided to be more, we have a behavior that's called customer first. We've decided to fill that with meaning. We've decided to help people understand what they need to do, so we are customer first. So that was the starting point. It was not, we don't know. It was more like, let's get together and see how we approach that, we fulfill that promise that we already made to our employees. And then you talk about how do you get the data and how do you set it up. And very early in the process, we talked about, so we got data, of course. We already had NPS surveys. That was available. It was awesome. The team did a wonderful job. It's just, it didn't necessarily get the visibility it should have gotten. And then we looked at all the data, analyzed it, and we brought people together and we started writing a manifesto, like 2 pages. When we say customer first, what's below it? What can we tell people? These are the 3 things that you need to do to be customer first. And so that's your guidance. And then from then you take the data you have and you start looking at what are the things you want to tackle first and who's going to pay for it. It's always fun.
Yeah, so talk to me about that, because bringing sales, service, operations into shared customer experience accountability, like, it sounds nice on paper and you can have all the principles in the world, you can have all the strategies in the world, but in the end, someone has to pay for it. And paying for it doesn't mean like put the budget there. It means like aligning their goals with it and making sure that the priorities that you're seeing are shared. So what is your take on like where to start? Like, should we do a little bit across all those teams? Should we take one by one and go in? And what was your approach?
To be honest, the first approach is steel yourself. Become Teflon, because there will be so many frustrations on the way. There will be, because you feel, like I said before, I found it very logical. I don't think I have a big ego, so whatever works, let's just get to this goal. Let's put a team together, collaborate, but not everybody's like this, and people are scared and have their own goals and whatnot, which is why you need to bring the higher levels in so they can talk about goals. We did put in not as many customer focus goals as I wanted, but we could get agreement on one customer goal. And then the next big thing was somebody high up decided it should be NPS. Oh my God, what a disaster that was. Didn't work at all. And then you start looking into, okay, why didn't it work and how can it be better? And you work from that. So there's a lot of stumbling and getting up again, putting your crown right and taking the next step.
How long did it take to realize like NPS wasn't the right one? Because this is the hot topic, right?
It was awesome.
Just 1 quarter?
It was really awesome. Yeah. So what happened was, it was really cool in a way. So we had the NPS survey already for a couple of years, and we did see 2 points improvement year on year for about 5 years. Every year, 2 points more. Awesome. And then they put NPS in the target setting, and we had in 1 quarter 8 points improvement. And so the head of analytics and we didn't know how to, like, what do we do now? Like, we knew this was going to happen, but how do we tell people that the decision they made is not great? And so we went into our quarterly meeting and we presented, and our CEO, very smart guy, Franz, he looked at it and he started laughing because he knew immediately what had happened. He knew immediately there was a ton of creativity to get the good number. And he knew immediately, because then we looked at the response rate and how many surveys did you send out. And you know how you do it, right? You send out only to your friends. And so it was so easy for us because he understood and he started laughing. If we had to explain it, it could have been potentially quite awkward, but it was so easy that way. And we still believe you should stick with it for a year. You don't, because people get targets on it and incentives, and you don't change it during the year. So we try to mitigate it, and we put a second, when you do black belt, you learn not to sub-optimize, and you always have to do 2 KPIs at least to balance it out. And so we put in response rate, and we put a number of surveys sent out, and we highlighted those data as well. So the report became a bit more balanced, not just the answers itself, but also what's the free text, how many did we send out, and how many returns did we get. And then it kind of worked somewhat because we knew where to look. Because in the end, it wasn't about how green is the KPI? It was, can we find the areas we need to focus on, and can we have data that is good enough to allow us to align people around it and have them support it and have them put some money in it? I talk a lot about money, but honestly, if you're trying to do this and you have no budget, it's not going to fly. And then I'm a big believer in common KPIs. So when you set simple KPIs that are the same for service and for sales and others, then you have a chance. So we try to do that, but it's not always easy. I mean, it's always people, right? Some people get it from the beginning and some people want to shine by themselves. And in the end, though, you need that North Star. People need to understand where your way is leading. And on the budget side, we try to say in that quarterly meeting, we discuss and then we decide to do it, and then everybody gives some money, and it became difficult because then one business had less money than the other and one market had more than the other, and then there was, oh, I don't want to fund for you and I can fund for you but you can't fund for. It was a huge discussion. It cost us a lot of time. So after a year of this, we said, you know what, everybody gives a certain amount and we'll put it with the sponsor. And then it goes to everybody, and I don't care who's giving what, everybody benefits from it. But we did have a point at some moment, because budgets are tight, right? So it's fully understandable where people didn't want to be the pilot, because then they would have to pay for everything. And that's not fair, and it was difficult. And then we said, okay, everybody gives a little bit, one bucket goes there. You all decide. But then we don't have to discuss that part anymore because that's already covered.
Where were some of that funding going to? Like, what kind of projects, initiatives that?
So we built a little bit more of a team. We did work with an agency for interviews. We did customer videos. So we have a little television studio on the Philips side, but you still need to pay for the time and the recording process quite. So we did videos to engage employees. We did the biggest project we started with was customer journey mapping for radiology, which is all the big IRM businesses, Magnet, MR, CT, DXR. We wanted to look into what steps does the customer take and where we have gaps. You know better than I how that works. And so that was the first one we did. So I had to bring in more people from the design team in Philips, which is an internal consultancy. You have to pay for the time as well. And we hired 2 people on the business side to run it as a project and bring those 4 businesses together and do that. So we had people, we had agencies, we had video times, all kinds of things. Honestly, it wasn't that expensive, but it's just always a discussion because that's how businesses are run. I think most people will have that experience.
What I'm seeing is that there's now a shift towards removing like a center of expertise or like a central like customer experience function and really embed it with the teams, where it's more on a leadership level where, to your point, shared KPIs are defined and we all show up together towards the customer. Yes, we have support from customer experience professionals, people who know how to do research, from ethnographic studies to like even running the simple things like surveys. We have experts for that, but how we show up together is about what are the growth metrics that we all go about. Yes, sales plays a big role in achieving them and closing deals and signing new customers and expanding them. But it's about identifying the shared friction in the customer experience that will help us unblock and lead. And that's where then, again, the customer experience function comes in to really understand, like, how do we all speak the same language? How do we make sure that we can share that responsibility so it doesn't feel like a sales goal that the operations team needs to contribute towards and that's outside of their scope and their KPIs? So I think like what I'm seeing is more like the traditional way was there's a central function that helps to understand, but then you get into like journey mapping and research and it's all wonderful, but then we have the understanding and nothing happens. So embedding it is the next level of like doing this in practice. Like, was that something that ultimately you got to at Philips, or like would you approach the work the same? Maybe that's a better question to say, like you can redo it again. You are hired tomorrow to start from scratch. Like, would you approach it the same way?
So I do think the embedding is key, but I don't think it means you don't need the central team. But I also think it depends on what your company is, what they do, and what your culture is. But to my experience, what I did. So one, you just said operations, it's not part of their scope, and I would disagree with that. I ended up in operations by chance in a way, but it turns out a lot of the customer pain points were actually around delivery and installation. So it is a big contributor. So they will not have NPS because it means nothing to them. But what we did is we helped people translate customer experience into what they do for that. So you will not get an NPS score maybe, but you will get a score on how many times do you have to shift a delivery date. Can you install so the system is up and running in the one day?
Right,
How
but
many
this is what I
parts are
mean, right?
missing?
It's like you're
Yeah, so they
turning
get
the
you
operational
KPIs, but
goal
they're still
into
part of,
something.
like you, yeah, exactly. They're still part of the whole thing. I do think you need the embedding because people that work with customers in the market and in the business, they know the business and the market like no one else, right? They should know. They know, usually.
Yes.
And they need to live it and they need to have the accountability for it. Otherwise, there will not be the passion for it and it will get pushed aside for something else. It also means you cannot have only people that do it on top of. You need 1-2 people that do this full time because when the going gets tough, the on top of stuff always gets pushed aside because it's like a hobby. I do think for a company like Philips, you do need a central team because you have all those different businesses and the customers really, really, really don't want all the businesses to have different approaches. So you still need that central coordination, framework, and guidance because they already have 2 or 3 suppliers in a hospital and then they have 3 different modalities from a supplier and they really have already 3 different customer portals and 3 different service people and 3 different phone numbers because of the different suppliers. They really don't want one of the suppliers to have 4 extra ones. And so that's where you then have to be sure that between the different businesses and different functions, things are coordinated so that the outcome is what the customer wants, no matter how difficult it is for us. For us, it would be easier to just do it, let every business do their thing. Man, customers were upset about that. And rightly so. I had one customer, a wonderful person in the US, and we talked a bit, and she said, "You know what? There was somebody showing up the other day, and he was showing me the new AI strategy for my CT." And I said, "Awesome! How did you like it? This is like the next big things in CT. There's so much you can do with the image diagnosis." And she's like, "Yeah, I sent him home again." I said, "Why?" She said, "I told him to come back when he has one AI strategy for all the products I have from you." It's not what the
That's
businesses
exactly it.
necessarily would like, but it's what the customer wants, and I understand that. And then you have to find the consensus that, okay, if this person that is such a good customer and such a wonderful person and she's using the equipment, if that's what she needs, maybe other customers also want that. And I mean, it makes sense if you think about it, right? They use 4 different equipment types and they don't want different AI strategies and different user interfaces for each one. It's just not something you would think about by yourself when you look at the, business by business. And
Exactly.
that's
And
I
when you
think where
come
the
from this
central team
business
comes in, but
perspective,
it can be tiny. It can be a tiny central team. It doesn't have to be big, 2 people, 3 people, but there needs to be someone who pulls the threads together and says, okay, now everybody in one room because here is where the everybody by themselves ends and this is where we need to align. And then you can go and do the product features the way you want, but you have to align on how you deliver service or whatever it is. Sorry.
I'm baffled by the fact that so many teams understand this in theory, but are not able to put it in practice. It just sounds so obvious to go with the practitioner, go
Incentives.
with the doctor. And yeah, I understand how it's structured. I totally get it. It's like we're making an AI feature to make our product specifically better. And it is fundamentally different and we love it. But then it doesn't compile with all the other stuff in the operating, whatever it is. And then, yeah, it's not a big lift to see that is a problem. And yet, in our little bubble, it is. What should leaders do differently to bring this perspective faster to the teams? I mean, ultimately, you will realize it because the customer keeps saying it, but that unique insight from her should almost be enough to take a couple of those teams together and say, okay, here's what our customer is saying. Do you have proof that that is not true? Can we actually work with this? But we're not doing it. And it feels like we're going around this, around this, around this, around this. So what needs to shift in a large organization to not have this conversation again in 5 years with the next Tina? Like,
Who
how should
knows?
we do
I
this?
don't know if that's possible, but I'm going to come back to something I said earlier, because what was the first thing I did after the discussion? I went home, I let it sit over the weekend, and on Monday I went to the accountant and said, I need to talk to the doctor again. It's okay, why is it? She needs to put this on video. What she just told me needs to be on video. And luckily, this wonderful lady did put it on video. So we had the same discussion again. I recorded it with her agreement, and I cut it a little bit so it's not too long. And this is then what I showed. Because remember, they can always argue with me. It's hard to argue with a customer that is spending millions on your equipment and that is outstanding in her field, a thought leader, and you really, really want her to speak for you. So you don't argue with that woman. And so that was the first step. I do think you'll always have that discussions, but in the end, I honestly think a lot of it is really a question of accountability and KPIs. The amount of time, the number of times I've had a discussion around we need to change the KPI so we incentivize the desired behavior. If you want people to change the behaviors, you have to change the way they're incentivized and their job descriptions and their goal settings. And for me to just get the answer is people will do the right thing. Are you kidding me? If you give me 15,000 to do A, I'm not going to do B. There are leaders where they say, no, I know why we made this decision, and I know you did what was needed, so you're still getting it. But there are also people that stick to the letter, right? And so if you give me $15,000 or euros to do A, I have to assume that that's the right thing. Why would I assume that that's the wrong thing if you're telling me this is what you get your bonus for? And so it needs to match. If you want people to farm, don't pay them to be hunters. Don't. It sounds a lot easier than it is, but normally you would have KPIs and incentives. The incentives should be tied to the KPIs, and you have it from the top and it flows down the organization. I used to have in service, I had a functional manager and a hierarchical manager, and each gave me 5 goals with 6 subpoints. So I ended up having like 60 goals. It's ridiculous. It's not going to work. And so make it cleaner, easier. And Philips has done that. Now we have 5 each. And now beautiful would it be if everybody then was aligned towards the same goal. And they should be. I don't know why that not always happens, but you should get incentivized for working together to make the customer happier and not on your business. But right now, there's still like I think we've changed it now, but there used to be a line of sight to your business. I think that's out now and everybody is Philips line, and that should drive improvements because then you have a common goal. I heard once, I don't know if that's true, Joachim, I heard once from someone Adidas has 2 KPIs, sales and NPS.
Ooh,
Beautiful.
I cannot comment on that. I
No,
mean,
but
wouldn't
wouldn't
that
it
be
be beautiful,
beautiful?
simple if that's true? I don't know. I know, I'm not asking you, but it's so simple, but I could see it work actually. Sales and NPS. Happy customers, but making money.
Yes. I would argue there's then only one necessary. It's like growth, right? If people are able to become customers, stay customers longer, then your NPS is irrelevant because you can still game it. Ultimately, it's that people are staying longer with you, wanting to do more with you, and NPS can be gamed in so many ways, and revenue simply can't.
So that will work for Adidas. It will not work for a life cycle of 10 years because you need then customers to buy something every year if you just have growth. And then you come to the point where customers will complain about you always showing up wanting to sell something instead of just sometimes supporting them without a sale this year. But for Adidas, it would work. I think you're right because you buy shoes whenever you need shoes.
Yeah, of course. But also, like, I'm not too certain that like NPS is then the best way to think about the long-term relationship.
No, I agree with you on that.
Okay,
I like the balance of
same.
having a customer happiness KPI and having a sales KPI. I agree with you. I'm not sure NPS is the answer.
No, and I'm also like customer happiness is good, but customer success is better because happy customers might switch the next day to someone else, right? Because they're just okay, they're fine. So are they really successful? Can they demonstrate they can do their job better with Philips than with anything else in the world? I think that's what you want to gun for, right? Unless your AI solution just does one part of the job and not the other 3 parts that you also want it to do.
It's funny,
and that's innovation. And then you get permission to do it again. But like, you can't measure that on NPS or any equivalent measure on CX that we're accustomed to.
You just have to have the balance. I truly believe that because it's very easy to make customers happy if you're not looking for sales, right? Just give it for free. Easy peasy. It's also easy to game the system. It's interesting what you just said about they might be happy and go somewhere else. When I did my trainings, I always said that. I said, it's great that they're happy. I need them to buy. I don't care if they're happy and they're not buying anything from me. They're happy with me and they go buy somewhere else. I don't care. Which shocked people because the customer experience function has the still the perception that we're like happy-go-lucky, shiny, happy people, all emotional, working on experiences and making people happy. And in the end, no, we need to sell. Come on, let's be clear here. And then there's always one person in the training that will speak up and say, the customer is always right. It's like, no, they're not. Come on. Of course not. They're not always right. And you don't always have to give them what you want. In fact, I had a separate training on how to say no and still be nice and still have a good relationship. That's tricky. Giving them what they, How do you say no?
The best example of this is actually like people forget about it. They say like, what's the most customer-centric brand in the world? Many people say Amazon. But why is that? Not because they make customers happy. No, they have incredible speed and they lower their prices. That's their strategy. That's all they do for their customers. So when they're doing that,
there's one more thing. So Amazon, I think, is price, selection, convenience. I think is their kind of three things. And for me, I think they're amazing in two things. One is KPIs, what we just talked about. So I once heard from someone, Amazon doesn't have NPS, right? Sometimes they say, was your delivery nice and as expectation, but it's not 1 to 10 or 0 to 10. But the CX team they have, the goal is to have no customer look for help. So everything has to work so perfectly that the moment you type into the search bar contact or help with an order, their KPI is not green anymore because something went wrong in your experience that you even needed that. And I think that's amazing because they don't even have to ask you. They just see what you're doing. I think for me, Amazon has figured out what are the moment that matters to their customer because they're not doing everything great. There's areas where I needed help with my Kindle and wasn't happening. But they do know what's important. You just mentioned price. It's a great selection. For me, it's important I can return easily. I don't even have to bring the box anymore. In Germany, I go to the post office. They have my box. They scan the code. They package it. Easy peasy. I can order without any risk because I can return. So I think they have journeys and they have really figured out, because you can't look at every pain point, right? You can't fix it's unrealistic. They have figured out what are the 2 or 3 things that are super, super important. And they relentlessly go after those few things. And I think that's super cool. Really, really impressive.
And that's the thing about experience. It's like we think like happy-go-lucky, as you put it. But if you work in the Amazon context, experience means something completely different than when something goes wrong, in your case, in the machine, you need to have it fixed. No AI can do it. I want to talk to a person. It's a do or die situation, literally sometimes. So experience means urgency, emergency. And in other cases, like if I take my kids to Disneyland, I'm going there to be entertained. I just want to have a good time. I want to have those memories. So that's what experience means to me then.
If and then pricing is maybe not so important, or the hotel 100%. Location is not so important because you're going to the park and you want your kids to smile for a week afterwards, right? And that's that's your measurement of success. And I think understanding that context, that is what makes a successful company. I would also argue that not everybody needs to be outstanding. If you print, like I said before, you print postcards, or I don't know, there's so many things that just need to work. I don't need my insurance company to be outstanding. I just need it to work.
And when Amazon do you find out? 18 years later after you signed the contract, because then something happens and you need them. That's the test when you know your insurance company is delivering on your experience. Yeah. Not the moment you sign up and, you know, the process was easy and you could like get the insurance.
Am I getting money when I need it?
Exactly.
And you
and
don't
how
need
do
to
they
be
help me
outstanding
if I'm not entitled to my claim, right? And that defines the experience.
Yeah, and that's the proof of the pudding. It's always when something goes wrong. Everybody's great when it goes well. When something goes wrong, what happens? And I would say if you as a company, if you know who you are, if you know who your customers are, but you also know yourself, and you tailor it around that, maybe CX isn't your most important function. Maybe things just need to work and your most important function is operations. I don't know. It depends on who you are and what you deliver. And I personally don't want to be overwhelmed by every single interaction. Sometimes I just want to buy a ticket for something, and if that works, awesome, and I'll give you 5 stars. But don't make it special for me. Just, make it smooth, easy, click, done. And I think you need to understand that. I think there is a danger on everybody wanting to go all in on experiences. And maybe as a customer, it's okay if that's not always the case. It just needs to be easy and work depending on what it is that you are offering to your customers, right? You don't have to be super special. And also people, you raise expectations constantly if you are. Tough.
So are you saying CX shouldn't be a department at all?
No, I'm not saying that. Of course it should be. But I think in some companies it needs to be larger than in others. I do think you always need someone to pull the threads together. But I also think if you are producing paper packaging, maybe it doesn't have to be bells and whistles and special experiences all the way. Maybe it does. I don't know. I don't know the companies, but I think you need to be very clear in what is it you are, what's your space, what you want to achieve, how do you achieve it, and then there's differences, right? Disney will have much higher CX costs than anybody else, of course. They deal in experiences. They are an experience, the whole thing.
Exactly. Everyone wants to be like Disney, but when you apply their philosophy to any product, like it will dramatically break down.
It really shouldn't.
No, it's just ridiculous to draw that analogy. I know what people mean when they say that. They don't believe that the customer is as important as they currently have it, but it is what you say. It completely is aligned with what your product and service is actually offering, and therefore what it means to your customers to deliver that. That is what the experience should be about, not like adding something that isn't necessary.
Right? Consistency, reliability, and authenticity. I'm a big believer in that. I think people can tell.
Where do you go next, Tina?
I don't know. I want to work with CX, definitely. I think I'd like to do something, maybe part-time advisory, something like that, and really work with many different companies to do exactly what we just talked about, to understand what is their space, what should the CX look like, and then strategy is good. But my passion is really making it stick afterwards, making sure you have the KPIs, you have the trainings, you have the incentives, you have the org structure that supports what you want to do. Because you don't want to be the CX police. I don't want to police every interaction. I want a framework and empowered people, but they need to know where to go and what the framework is, and then give them the means and the tools to do their job. And when you call someone or I call someone, I can tell if they're empowered. They make a decision for me that helps me. Or if they're just sticking to a script and just, I can't help you. This is the next step, right? And you give them the framework, you empower them, and you make it work for your industry. You make it special for where you are and for your customers' expectations. And doing that with different companies, I think that would be super cool. But nothing's fixed yet. Still trying to figure it out. It's exciting. It's really cool.
Operationalizing it. Tina, if people want to reach out to you, I know you're on stage in many different places. Like, what is the easiest way to get connected with you?
LinkedIn. Okay. LinkedIn is the easiest. I'm working on a website, but it's not live yet. So LinkedIn for now is the easiest.
I'm going to put a link in the show notes. Thank you so much for spending time with me today.
You're already fantastic. Done? It was so fun. I still have like tons of things to talk about. Oh, man.
Okay, we should go for round 2 then. Let's do that. We are going to do a round 2. Maybe a little bit later next year, as we started joking about in the beginning, and to really see like where Tina has landed and what is going on with AI, and are we still seeing the human elements in that? Tina, thank you so much for joining me today.
Thank you. It's a pleasure.
All right, and that's it. Thank you so much for listening. If you found this valuable today, don't forget to subscribe to The Experience Edge on your favorite podcast channel, leave a review, and share it with your team. I'd be delighted. Today's episode was brought to you by Daydo, the AI journey management solution for enterprise. To have an edge on your business strategy and to know why your customers do what they do, visit daydo.com and explore more resources to accelerate your customer experience game. And remember, the journey to creating customer-centric impact never ends, and there's always a new edge to discover in doing things differently. Next week, new episode. Until then, keep pushing the edge and stay inspired. See you in the next episode.